Global Fund is investing not only in separate countries, but it is supporting regional programs that provide catalytic investments to turn the tide of HIV and TB epidemics. With a regional program in Eastern Europe and Central Asia, we were able to make incredible progress in such areas as innovating in AIDS response. For the first time ever, we brought critical HIV prevention, such as pre-exposure prophylaxis, to a number of countries in Southeast Europe, in North Macedonia, in Bosnia and Herzegovina, in Montenegro, which had never been there before. We were able to share the bright experiences from other countries like Ukraine or Georgia to support, to enrich program development and implementation, and now transition to the domestic funding. We are bringing such critical innovation as long-acting treatments. Ukraine is the first in Eastern Europe and Central Asia to pilot long-acting prevention with long-acting cabotegravir. The experience in Ukraine will support the development of this approach, so much needed in Eastern Europe and Central Asia more broadly. Unfortunately, the region is still home to hostile policies towards key populations and people living with HIV. Many of the countries still criminalize putting people at risk of HIV infection, or criminalizing individual drug use, sex works, LGBTQI. With the help of the Global Fund regional catalytic investment, we are able to turn this tide. With the Global Fund program, we have been recording cases of violations of human rights across 14 countries in the region. We're not only recording them as community-led monitoring REACT system, but we were also providing response to them. Thanks to the support of paralegals, with the support of key population networks, and delivering our reports across various dialogue spaces to support legislation revision, which we were successful at in a number of countries. Harassment of people who use drugs is still happening in many countries in the region. With our programs, we have supported the establishment and operation of the Regional Commission on Drug Policy, headed by the former President of Poland, Aleksander Kwaśniewski. This commission now is supporting make the harsh drug policies humane in these countries. Thanks to this, we are not only safeguarding lives of people and are bringing dignity to people who require medical health in the first place, but we were also supporting the better investment in healthier communities. Instead of putting people in prison and allocating massive resources to imprisonment, we are actually helping to transfer this funding to health programs. The Economist research showed that in the course of 20 years, in just 4 countries, if we decriminalize drug use, over $11 billion will be saved. And if they are transferred to health, we will be able to stop HIV epidemics in these countries without any additional resource. Regional Commission on Drug Policy is supporting individual governments to progress in better drug policies, in healthier people and in healthier communities. We are also supporting across our regional portfolio the work to transition from international donor funding in selected countries to domestic funding. We are supporting the development of national programs, of national legislation to allow provide social contracting, inclusion of HIV programs into insurance schemes, so that countries, after the donors are leaving the country, are able to pick up the efficient and critical interventions and allocate wisely to stop HIV in their respective countries. We have mobilized mayors across the region. We have worked in 13 countries with 35 cities who have taken on the commitment to respond to HIV epidemics, to end HIV in key populations, and to source this response with their municipal funds. It is critically important to support Global Fund in this work because the model that the Global Fund is offering is unique and is very efficient, and it has proven its efficiency. Firstly, because all of the Global Fund programs are very much result-oriented. They are focused on saving people's lives from 3 killer diseases. And this is the way every program is developed and is targeted. Global Fund is very savvy in terms of technical focus of the interventions, but also in terms of involving local communities, local governments, local players into the response that they are supporting. All key national stakeholders are the developers of their programs. They are owners and drivers of the program, which is so critical important for these programs' sustainability. The Global Fund portfolio management is very efficient in uniting expertise and knowledge of the top level to support program implementation as it continues. The investment that Global Fund made in selected countries or in selected regions has been a catalyst and has proven that it has developed necessary response bones and muscles in such challenging situations as changes in climate or as a crisis, as in my own country, in Ukraine, which manages to keep HIV and TB epidemics under control, even in the situation of war. Global Fund was incredibly efficient, stepping in the case of COVID, where we have complemented our HIV responses with major COVID interventions. This is the mechanism that has worked and has proven its efficiency. It has incredible value added, saving not only lives, but saving lives, communities, and societies. And this is what we are here for, to support healthier people, healthier communities, and healthy nations. Invest in the Global Fund.